40 minutes with us this morning.
Yeah, no, that's totally great. Thank you.
Cool. So, I know that you are pressed for time. And so if you don't mind, I'll just jump right in.
Yeah, please.
There's so much in common. So our personal lives, we can delve into that later because
okay.
has been sharing so much with me already. I live out here in Park City, lived here for almost 10 years from Southern California, but we can get into all of our corporate background and good stuff like that later. What we're really excited about is what's brought Lois and I really close. We were ski buddies.
Okay.
I introduced her to this company a couple years ago. And Lois has been, using our products, and she can tell you her story real quick about, there's no denying what this does. I'm going to walk you through some of the science. But her husband actually introduced me to one of our U.S. Olympic athletes that her husband Scott worked with as a sponsor. And we've literally turned the trajectory of his snowboarding career around. He's now ranked 5 in the world as one of the oldest snowboarders on the tour. And so we've kept in touch through these products because of I love the business side. She loves the health side. But when she has seen how well Nick Baumgartner is his name has become with the company, she says, maybe I should start to take this a little more seriously.
Right. Exactly.
And so I'm going to delve into the science. And what Lois said is, you definitely are very adept at health nutrition, which is great because this is going to make a lot of sense to you. Want to say?
Well, I don't want to talk too much, but I'll give you just a little bit so you understand. Because Steph and I are doing something else on the side.
Her clothing right, the clothing line, which I love.
And
okay.
I'll talk about that another day next week because I have some things on the fire with that stuff too. So, this just happened by accident. I was skiing with Karen, and there was a man on the mountain named Paul who was a gentleman. He was my boss, but he was one of those very fun bosses. And he was a little crotchety. He had like a limp. He was very, he wasn't very agile. It's probably the best word. And and his mood was sort of snippy. I mean, he was always nice to me, but he wasn't always like that to other people. Anyway, he started taking this supplement that I didn't know about at the time. And I would say in about 2 months, 6 weeks, I noticed a difference. He was always a great skier. That's something he always had, but I noticed he was less agitated. My husband said to me, have you noticed, Paul? He's become this very young, fun, spirited. Anyway, he was taking the supplement. I didn't know. His skiing improved. His energy improved. His attitude improved. So I decided to try it. It's helped me in multiple ways. My hormones are better. I have more energy. The best way I can explain it is I used to want to press snooze and go back to sleep for like 15 minutes, and now I don't. So I don't want to be too wordy and lengthy, but that's really what I saw in other people. And I just wanted to share it with you because I know you're into health and wellness and yoga and design and other things, but I wanted to give you the opportunity.
Okay.
Yeah, so super quick, I'm going to run through this fast. And Steph, if you have questions along the way, that's why it's kind of cool. It's as if we're in the same room,
Right.
And I can sidebar. But knowing your time is precious, I'm going to run with this really quickly. The science, unprecedented in the health nutrition, we call it supplement world. And so before I start with anyone, I always share this reality. And the reality is if I had tried, and I mean, people use this analogy a lot and it's kind of overplayed at this point, but the truth is if I had tried to tell you 10 years ago the technology that would be contained in our phones, you would have thought, no way, too good to be true. Back when we were using Blackberries and you were happy to have a black and white pixely picture, the idea that a phone could do all that it does today would have sounded too good to be true. And then if you look at the iPad that came out, I mean, think about it. I know for myself, I was introduced to the iPad really early on, and my first reaction was, who needs one of those? Right. I have a computer, I have a laptop, I don't get it. And so I hesitated. I had no interest in that new technology. And it wasn't until I saw it in use time after time after time, and Apple had grown sales to probably 20 billion worldwide, that I finally bought my first iPad. And so that time, what most of us as human beings, change is hard, something new we resist. And during that period is when companies have that exponential growth. And so today you are being introduced to a company just like Apple, who at the time was the other computer company. I, was in graphics and I was the branding director for Hilton Hotels Corporation for 15 years. So I actually worked on Macs. I was the creative type. I didn't have the PCs, but the rest of my world was PC operated. And so the point is, most people snooze through that pioneering phase of technology. And that's what you're being introduced to today. So our company is called LifeVantage. They are a scientific biotechnology publicly traded company, been around for over 10 years, and they have the patents on a new biotechnology. It's called activation. In a nutshell, when we think about health today, many people get into the idea of supplementing with antioxidants and vitamins. That technology is actually outdated, with the realization that our body actually has protein messengers in our cells that we can activate that are millions of times more efficient and effective than consuming antioxidants and your vitamins and taking them in as a food source. And so this technology, while it sounds, too good to be true, it's not. It's science. And I'm going to walk you through some of the incredible validation we have today. But this technology, LifeVantage is first to market with it. And the pharmaceutical companies are catching up, which is a good thing. And I'm going to explain why that's a good thing for us as opposed to a competitive thing. Pharmaceutical companies are investing billions today in NRF1, NRF2 activation. If you were to just simply go online and Google NRF2 diabetes, NRF2 Alzheimer's, NRF2 heart disease, you're going to be, I can't believe this. It's not just anyone. It's the American Heart Association. It's the American Diabetes Society. It's, Michael J. Fox Foundation just invested $1 million in NRF2 research for Parkinson's. So all this is going on behind the scenes. No one knows about it, but we do. And so let me explain it really, really simply. So an activator is what we are. So it's category creating. There is nothing else on the market that does this. And so what do we activate? The easiest way to explain our first product, which is NRF2 activator, is this. Your body wants NRF2 active in every cell. And it has a lot of ways that it's triggered. One is taking a brisk walk, okay? So if you think about how you feel before a brisk walk, you don't even want to go for the walk. After the brisk walk, you feel like exercising more. For me, I want to go play tennis after I've taken a brisk walk. I'm like, let's do it. Right. Think about your food cravings before a brisk walk. Before a brisk walk, you want to open a bag of chips. After a brisk walk, you're like, hey, I've got the energy. Let's make a healthy salad. So everything in your well-being shifts. That brisk walk has activated NRF2. NRF2 turns on what are called your survival genes. And every cell in your body starts to respond to what's wrong. They talk about endorphins. They talk about upregulation of our important antioxidant enzymes. Superoxide dismutase, glutathione, the athlete antioxidant. Taking Protandim, activating NRF2, upregulates your body's natural production of glutathione by 300%. It's clinically proven. And catalyze a number of antioxidants. And so I tell people, if you like the way you feel after a brisk walk, you're going to love our product. And just like taking a brisk walk is safe, so isn't activating NRF2 all naturally with our products. And so with that intro, what we're going to do real quickly is 10 years ago, Stephanie, ABC News learned about our company, LifeVantage, and the product they had brought to market. And the product is called Protandim, the NRF2 Synergizer. And they heard the medical claims that the company was making. And that medical claim that is now FDA approved, which is unheard of in the supplement industry to have an FDA approved medical claim. Our medical claim is this: taking Protandim for 30 days will reduce your oxidative stress by an average of 40%. Now, that medical claim doesn't mean anything to anyone who doesn't understand oxidative stress, but most people that are into health, nutrition, medicine today know oxidative stress is the precursor to every disease. And you'll hear the scientist in this interview explain, Aging is one thing biochemically. It is a steady and progressive buildup of oxidative stress. So when ABC News heard that our company was claiming to reduce oxidative stress, reduce the cause of aging by an average of 40% in 30 days, they said, no way. And they set out to debunk the company, which of course is the genre for ABC News, or ABC Primetime, I should say. And they sent their investigative reporter, John Quinones, to investigate LifeVantage. And typically those stories wind up with camera crews chasing down people, trying to interview them, and they're hiding. Very different. This is probably the first episode that's ever aired that's super positive about a company. So John Quinones, just fast forward, became 2 or 3 years later when our company shifted from direct consumer sales with their products in GNC, CVS pharmacies, and shifted to direct sales. John Quinones became one of the first major investors in our company, and he's never gone off our product. So he's been taking it for over 10 years. If you see John Quinones today on, he does that show, What Would You Do on Friday nights. He looks younger today than he does in this episode, which was aired 10 years ago. So we'll watch this together real quick. I've condensed it down, but it's important to see the foundation behind our company and this product.
Introducing a product video for LifeVantage, a publicly traded company and industry leader in Nerve2 activation. A recent peer-reviewed study from Washington State University calls Nerve2 activation one of the most extraordinary therapeutic and preventative breakthroughs in the history of medicine. As you can see from this medical slide, oxidative stress and free radical damage negatively affect the human body, leading to things like asthma, cancer, diabetes, and much more. Many of the products shown in this video activate the Nerve2 pathway. The question is, can reducing oxidative stress benefit the human body? Our story begins back in 2005 when LifeVantage was investigated by ABC News. As you watch this investigation, ask yourself this question. If this product really works, why would I ever stop taking it?
You want to get an edge on turning back the clock with just a few pills? Who doesn't? Well, it's no longer science fiction, but science possibility, a potential breakthrough. As I found out firsthand, there may be a way to erase years, at least inside my body. Granted, it's down the road, but some scientists are wondering if a new pill I took might offer a very long life. It may not look like the fountain of youth, but inside this nondescript building, I'm about to become part of an exciting experiment, a kind of guinea pig. Dr. McCord, okay. I'm here at the University of Colorado in Denver to meet Dr. Joe McCord, a world-renowned scientist. His latest research could very well unravel the mystery of aging itself. And his decades of experiments may have the potential of adding years to people's lives and possibly prevent chronic diseases like cancer, diabetes, and heart disease. It all centers around this small yellow pill, and for me, it begins with a blood test. They want to check my levels of something called T-bars, which is a rough indicator of a person's actual age. T-bars can identify a condition known as oxidative stress, a kind of measure of the wear and tear on our bodies. Oxidative stress, like the rusting of an engine, is not a good thing.
Bad for the body,
Leading to disease.
leading to disease and leading to malfunction, and importantly, leading to what we call aging. It is a slow progression of increasing oxidative stress. That's the main characteristic biochemically of the aging process.
For a long time, scientists thought that antioxidant vitamins like C and E would lower it, but they don't.
It turned out in just the last 5 years or so, we see that they're not good enough tools. They're not powerful enough.
But this pill, he says, is powerful enough. In fact, many times more powerful. With that swallow, I've just become part of a potentially landmark scientific experiment. It's called Protandim, and tests on both mice and humans have already shown that it revs up the manufacture of those good enzymes in our bodies. More enzymes, fewer free radicals to harm us. Whether that will lead to longer life is still unknown.
So you can see the age-related.
Normally, oxidative stress, measured by those T-bars, increases with age. But in Dr. McCord's tests, taking just one pill of Protandim a day reversed that trend for everyone at every age, even for an 80-year-old.
They all are reduced to the level of oxidative stress that one would expect, frankly, in a newborn or a very young child.
Back to the oxidative stress levels of a child? It sounds too good to be true. Will Protandim work on me?
The scientific evidence is there. The pieces seem to make sense. The question is, does this translate into something that humans can take advantage of?
So, just what's in this seemingly incredible pill? Well, actually, its roots are very humble. Protandim is a combination of 5 plant ingredients. Some you may know: green tea or turmeric, a spice used in Indian cooking. Others, Withania somnifera and Silybum marianum, are more exotic.
There's a huge human experience with each of these ingredients. They've been used often in traditional medicine in India and China and many other cultures, in some cases centuries and centuries.
And so, ancient Eastern healing and modern Western medicine may soon be working together. High oxidative stress is associated with more than aging. It's been linked to hundreds of illnesses.
We make no claims about curing any disease or preventing any disease. We hope that when enough studies are done, perhaps such claims might be able to be made in the future.
But what about my progress? After nearly 2 weeks now, it's time to get my results. Dr. McCord calculates the numbers. The result? My level of oxidative stress has declined dramatically.
45%, that's excellent.
Just look at where I fall on the graph, before and after.
Which, if extrapolated back, is the level you would see in a newborn baby.
Have we turned back the clock? Well, maybe not on the outside, but deep inside within my cells. Yes, indeed.
Would you suggest I keep taking this supplement?
I would.
Imagine a world where the cells in your body become more capable of coping with environmental and biological stresses rather than less. Imagine a world where you don't take antioxidants and simply hope they work, but where your body's ability to combat these stresses is awakened so that you can fight them naturally on your own. Well, imagine no more. That world is here. It's called Protandim, and it's only available through LifeVantage. Only recently has science discovered the process by which the body can protect itself from those daily stresses. That breakthrough discovery is NRF2, a protein messenger that binds itself to DNA and is a master regulator of the body's aging process. The technology at its heart has been studied by some of the world's most respected scientists and universities, validating the lasting, health-enhancing benefits it delivers. Comprised of natural plant ingredients and protected by 6 patents, Protandim is the only supplement proven in a clinical study to reduce cellular stress in humans by an average of 40% in 30 days. The results are undeniable. Try it today.
All right, so that gives you a little kind of us then and us now. And does that make a little bit of sense to you, Steph, with your knowledge in nutrition and whatnot?
Yeah, I actually put raw turmeric and ashwagandha root in my smoothie every morning.
That's phenomenal.
Yeah.
So you're,
I don't, do the other things.
right. And so what's interesting is as you delve into this science a little bit more, you'll understand that LifeVantage has 6 U.S. and multiple international patents on our all-natural product. And so if you know anything about patent law, you cannot patent naturally occurring ingredients in a blend. It's available to anyone. Where the reason we're able to patent Protandim is because they were able to prove that turmeric is good for you, ashwagandha is good for you, but they don't activate NRF2 unless they're in this synergistic blend of Protandim. And so they took a number of NRF2 activating substances and they tested them. And they call it literally a patented synergistic blend, because the use of any of those ingredients on their own, while good, do not do what Protandim does. And so they were able to showcase that, using any of the ingredients in any other combination is not going to produce the response in NRF2 activation, which is the ultimate goal of those products. So when you hear, turmeric is an anti-inflammatory, the reason it's an anti-inflammatory is it is reducing oxidative stress, the cause of inflammation. And so the approach that we now have with Protandim to actually activate the healthy enzymes in our bodies to do their job, has basically made all that pre-science obsolete. And so I always tell people, gosh, like Lois, when we get involved, I've been involved with this company now for 5 years. I was introduced literally in their pre-launch phase when they were taking Protandim off the shelves and of the stores. And because the quick story for LifeVantage, publicly traded company, you can look them up and learn about them. When the products were available in the stores, people weren't looking for a NRF2 activator. They had no idea what it did. And so it was sitting on the shelves next to antioxidants, berry compost and things like that. And in 2009, the scientific technology company, the scientific world understood what LifeVantage had brought to market. In fact, universities, they had hundreds of universities using Protandim in studies. And so today, you heard that scientists say, we don't make any medical claims, maybe one day some studies will be done and we can do that. We now have 18 published peer-reviewed studies out from universities around the world explaining what it is that Protandim does for all those diseases, from heart disease, Alzheimer's. We've got a huge, so all of that is there now in the science. But of course, in the United States, we're an all-natural supplement. So we can't talk about the studies that show what it does for disease because we're not designed to treat, prevent, or cure any disease. What we can say is that medical claim. Taking Protandim for 30 days will reduce your oxidative stress by an average of 40%. Take a look at your disease, see all the studies that say high oxidative stress is the culprit, and realize what that means to your own health and prevention of disease. I always say, you don't need to treat what you never come down with. And so, so really, really quickly, just because I tell people, as I was saying, when Lois or anyone gets involved, you aren't going to be an expert. And so we have experts. And so just like showing someone that ABC News episode is so powerful, sharing the recordings that we have of a number of physicians who started off equally skeptical, saying, come on, I'm an MD. I don't play in that field of supplements. And then they come full circle and they say, oh my gosh, not only is this a solution for me personally, it's a solution for every one of my patients. So we're going to listen to a really quick interview with this Dr. Mark Gordon. One of our partners, Brandon Cunningham from Florida, does just a quick introduction of him, explains all of his credentials, so I don't have to. But we'll listen to his appreciation for what it is that LifeVantage really, truly has brought to market.
Dr. Mark Gordon on the line with us. He's an MD. He's a board-certified cardiologist, has been for over 20 years. He's been involved in different phases of clinical cardiology. He trained at the University of Minnesota, and he participated there in multiple pharmaceutical and medical device trials as a clinical cardiologist. He also served as the governor of the state of South Dakota for the American College of Cardiology, where he was a director of medical education there. He has an extreme interest in preventative medicine. He recently completed a fellowship program in anti-aging, where it was done at the University of South Florida. He's completed advanced training in metabolic cardiology, as well as his passion for prevention. And this really fuels him, his desire to pursue preventative integrative cardiology in the future as a clinic, something that is a passion of his. And Mark currently is serving as the director of medical advisory board for LifeVantage. And as I said earlier, that's a mouthful of education and credentials. Thank you, Brandon. It's an honor and pleasure to be on here with you. Great. Well, listen, we want to be respectful of everybody's time, and we know everybody's busy, but I thought it would be great from your perspective and with your knowledge to be able to share some of the things, because I know every time I get to talk to you, I get more excited about some of the products I've been taking for many years, and I like to share that information as well. And I thought, well, let's not be selfish. Let's share this information with as many people as we can. So first, let's start with, your excitement for the discovery of NRF2 activation. What does that mean to you?
Well, I tell you, before I heard about Protandim, I didn't even know what NRF2 activation was, or NRF2. And I would venture to guess that 99% of the MDs out in the country have no idea what this NRF2 pathway is. And given my past history and interest in prevention, I've always had an interest in antioxidant therapies, and I was always looking at the medical literature about antioxidant therapy and heart disease and so forth. But what was extremely frustrating to me was the fact that all of the big studies on antioxidant vitamins showed that they didn't do anything to prevent cancer or heart disease. And after I learned about NRF2 that I began to understand why. It's because those types of antioxidant vitamins so many people are used to taking because they think that they're helping to protect their bodies against disease, things like vitamin E and vitamin C and so forth, are so incredibly weak at fighting the free radicals and reducing the oxidative stress. So when I heard about the NRF2 pathway, I thought, why haven't I heard about this before? And I started to dig into all of the research behind it. And what I discovered was this pathway, was discovered in the mid-90s and has been largely untapped as a resource to help with prevention or treatment until very, very recently. Recently, pharmaceutical companies have started to develop synthetic drugs that are NRF2 activators because they've recognized the role that oxidative stress has in disease progression and development and so forth. But let's back up a little bit and talk about what it is that NRF2 does, and this is what really got me excited. So if you have a standard antioxidant like vitamin E or vitamin C, one of those molecules of those things will neutralize one free radical molecule and the process is over. But with things like NRF2 activators like Protandim, what NRF2 does is it acts as a master regulator switch, and it goes into the nucleus of the cell where it turns on the genes that code for these antioxidant enzymes. Things like superoxide dismutase or SOD, catalase, glutathione, and hundreds of others. And those enzymes that your own cells produce are literally 1,000,000 times more potent at neutralizing those free radicals compared to vitamin E, vitamin C, and all of the other standard antioxidants. So when I learned that, kind of a light bulb went off in my head, and I said, now it makes sense. Now I understand why these standard antioxidants don't work to prevent disease, and why in some cases they may actually be harmful. So I kind of had a paradigm shift in my own mind about what would be the best way to reduce oxidative stress, and that is to get your body to make its own antioxidant enzymes through this NRF2 pathway. So that's why I started to get excited about this. And when I started looking at the science behind it and the studies that were underway, looking at what NRF2 activation can do for prevention and treatment, then another light bulb went off in my head, and I said to myself, this is going to be the next big thing in prevention and therapies for all of the diseases associated with oxidative stress.
So I think he does a great job of giving us kind of a medical perspective. So he was a very, very skeptical doctor. He was introduced by his patient to Protandim, started to do the research on it, and now he has been with LifeVantage for just a little bit less time than I have been. But now he has gotten out of his cardiology practice and has started an entire new focus, which is on the prevention of heart disease and integrative medicine. And so to hear, because we're on the more nutrition side, kind of I don't want to say anti-FDA, but a little bit myself. I don't like to take pharmaceuticals. So to hear an MD has completely come over to the other side is really powerful. Dr. Gordon now sits on the very elusive credentialed board of directors for LifeVantage Corporation, and is focused on preventative medicine. It's pretty exciting. And so this was that first slide that we saw, Stephanie, and it talks about that one particular study that you can look up as well. Washington State University just published last February, where they delve into the science of this NRF2 pathway. And, you know, scientists don't exaggerate, but the headline in this study is NRF2 may become the most extraordinary preventative and most extraordinary therapeutic breakthrough in the history of medicine. And, you know, I said scientists don't exaggerate. And so even in their study, this theme of sounds too good to be true comes up a lot. And the scientists even wrote that in their study. They said the finding that raising NRF2 may be useful in prevention and or treatment of this, and they literally list these diseases and why, seems almost too good to be true. However, and then they go into great detail. They talk about all these different diseases and how they were studied in the past. It was always studying them, the disease, its symptoms, how to treat symptom, as opposed to saying, wait a minute, what do all of these diseases have in common? They all share the same source: high oxidative stress, the buildup of free radicals, cell degeneration. The cells put an inflammatory wall up to protect themselves. It's inflammation, and mitochondrial damage. And so activating NRF2 solves those three things. The disease literally not only stops progression, but the body starts to heal itself because it no longer has the cause of the disease. It's phenomenal. And so, I mean, the studies are immense. And so it doesn't matter what area of the body you're talking about, all of our organs succumb to the same process in aging. Steady progressive buildup of oxidative stress, causing degeneration, causing inflammation, and then those diseases are inflammatory. Now, when I started 5 years ago and I would try to explain this to people, even doctors had no idea what I was talking about. But the conversation has come so far in just 4 years. People today know if they have irritable bowel or, you know, issues with, you know, sudden allergies, food allergies, and they're having to go gluten-free, it's because they have inflammatory issues in their gut. So the word inflammation and problems are starting to mean more than I need to take an Advil. And so that conversation is just where LifeVantage, kind of like that iPad, you see it, you hear it, you see it, you hear it, suddenly you're like, yeah, I need one. And we're finally at that point where this company is just taking off. And so here is something that's super duper important. So I mentioned about pharmaceutical companies finally starting to come out with NRF2 activating drugs. The number one drug in the world today for MS, relapsing multiple sclerosis, is called Tecfidera. If you watch nighttime TV, which I don't really do, but you will see TV commercials for Tecfidera. It shows a woman and her children walking across like an elevated wooden bridge.
Right.
Yeah. And the announcer is saying, if you have MS, there's a way to get your life back. That's fine and dandy. Now you're familiar with it, you'll see it. Listen to the end of that commercial to the like 3 extra minutes of side effects the toxic ingredients in Tecfidera cause to a user. But more importantly is this picture here. This is how Biogen pharmaceutical reps are educating doctors about their product. They go into the doctor's office and they say, listen, your patient takes Tecfidera, it goes into the cell, it activates this protein messenger called NRF2. The doctor will say, well, what's NRF2? NRF2 is like the switch that needs to be activated in the cell so it can respond to its stressors. And stressors are what? The free radicals. And so NRF2 turns on, it reminds the cell to upregulate the production of all of its survival enzymes. And those enzymes are going to flush that deteriorating issue for the MS patient. So what is MS but the most cellular and neurodegenerative condition? And what's causing that degeneration? The same thing that's causing issues with our own gut imbalances if we don't have MS. It's oxidative stress, free radical cells. So the good news, as these drugs start to come out on the market, doctors are going to be educated that there actually is a NRF2 pathway. And then they're going to go to PubMed and they're going to put in NRF2 and they're going to realize when a patient says, well, doctor, I'm really afraid of all these side effects. Isn't there a natural solution? The doctor will say, as a matter of fact, there is. There's this thing called Protandim. It's a NRF2 synergizer. We just need to find you a distributor. And so then that patient can have a natural alternative to this terribly toxic, deadly, brain bleeding is one of the top side effects.
My son says, Mom, why would anybody take that when they list all the reasons why? If you hear the commercial, it's crazy.
But it's even more significant because right here is a study. So Biogen actually conducted a study when they were bringing Tecfidera to the Netherlands, to Holland. And they had to go through the Holland F version of our FDA. And so Holland had them run a study, which Biogen funded. And in that study, they tested a number of NRF2 activating substances. So I talked about the brisk walk. Another product, another way to activate NRF2 is an enzyme in broccoli. Oh my gosh, I'm blanking on it. It's like cephorolane. You probably have heard of it. It's a NRF2 activator. And there's a couple products on the market that are cephorolane NRF2 activators.
Okay.
And so Biogen conducted this study and compared a number of NRF2 activators to prove to the government that their product worked, was efficient and effective at NRF2 activation. Their conclusions in this peer-reviewed published study, however, are amazing for LifeVantage, because down here at the bottom you can see our findings, Then they go on to say, interestingly, Protandim, a dietary supplement consisting of herbal ingredients, was the most potent inducer and therefore maybe the most suited as a therapeutic strategy. Now, again, we don't sell Protandim as a treatment for MS, but this is pretty powerful. The scientists paid for by Biogen actually say we should. And so this is the level of technology our company has, and no one's heard of it. And so the athlete side is what got me excited. So when I first learned about Protandim, I knew immediately. So I live in Park City, Utah. My kids were all on super competitive ski teams. Their coaches were, diehard former Olympians that, their knees, the inflammation in their bodies was causing them to take ice baths and saunas every day. And I'm like, guys, you've got to check this out. And I have turned around so many athlete careers by introducing this to them. Because what is it that derails an aging athlete's career? Oxidative stress, free radical damage, and inflammation. Their bodies simply can't recover fast enough to compete with the younger athletes, and they have to retire. And so that's no longer the case. So I told you about Nick's story. It's amazing. He went from being 26 or 27th in the world, which is horrible. He says, as an aging athlete, you're devastated to see that. Everyone's asking me, Nick, when are you going to hang it up? You can't be a professional athlete anymore. Are you going back to, construction? You're not going to be able to compete anymore. And he starts on Protandim. He's now 5th in the world. He placed 3rd in the trial runs in Korea for the 2018 Olympic course. And he's like, now when I tell people I'm not just doing one more Olympics, I'm doing 2, they believe me. They know something's changed, and I am at the best in my game I've ever been. So super quickly, I'm going to have us listen, because I think it's so important that you don't just listen to me. You listen to these amazing people that are joining this company because of what it offers. And so this guy right here, I interviewed him a couple weeks ago. His name is Simon Kessler. It's a short interview because I know we're running low on time. But he is the 15-time national champion cyclist from South Africa. We joke and we refer to him as the Lance Armstrong that never doped, because he never did. And he is known in South Africa, renowned by his name. He now lives here in Florida and runs an elite coaching program. But he's so cool. He actually also coaches triathletes and recreational athletes. And he has an online training program that's super affordable for people worldwide, really, called Simon Says Cycling. And so he's going to really, really quickly explain his introduction to Protandim and what it did for his career.
Awesome. Well, thank you again for having me. And just to elaborate on the story that I was sharing earlier, 15 times national champion, a coach to many athletes. 5 years ago, I was doing a coaching clinic and somebody introduced me to our main product, Protandim, the NRF2 activator. At the time, he piqued my interest primarily on what it could do for my athletes and for me in terms of recovery. I had no understanding that there was a business side to this, but I was very excited about trying this product to see if it worked on me. And I did. He gave me some bottles to try. And initially, I remember about 2-3 weeks in, I felt like I was sleeping. I was feeling more refreshed when I woke up in the morning, feeling like I was sleeping a little deeper. And then about 5 or 6 weeks in, I was training very hard at the time. And I was taking one of these Protandim pills, one in the morning, one in the evening, which is, double the dose recommended. But as an athlete, you're producing a lot more oxidative stress. So it made sense to do that in my mind. And I remember training 5 days very hard, and on the second day feeling better than the first day, and then on the third day feeling better than the second day. And that just wasn't normal for me. I just wasn't recovering like that before taking this product. And then on the fifth day, I decided to test my power with the power meter that we use in cycling. And I broke my current record at the time for a 15 to 20 minute time trial. So that was like, wow, this is something that I shouldn't be experiencing. I should be a lot more fatigued than I am right now. So that's when I got excited about telling my clients about this. Still had no understanding about the business piece, but one of the first people I told is a dear friend of mine, one of the best triathletes in the world. In fact, he has the 5th fastest time in history in Ironman triathlon of 7 hours and 52 minutes. And I got him on the product. His name's Dirk Bockel. And he, within a few weeks, he won, I think it was Ironman Louisiana. And I remember his comment to me that he felt like he was so much fresher than typically he feels after an Ironman, a half Ironman. He said he was walking around that night and feeling a lot better than he normally does. And then I remember him telling me a few weeks later, his adaptation when he went to altitude was so much quicker than typical. He always goes to Boulder typically to train for Hawaii, where he's actually finished 4th twice in the World Championships. And I got some of my other athletes on it. And so they were also starting to experience similar results to what I had. And really it makes sense. This product makes sense for athletes, even though this is really an anti-aging type product, if you were. This makes sense because we're producing a lot more stress on our bodies than the average person. And if you understand what nerve 2 activation does, it activates in the cells of our body. It switches on our good survival genes and anti-inflammatory proteins and so on. And we're reducing the oxidation, the stress in the cell, as well as the inflammation. And, as an athlete, you're producing a lot more inflammation and stress than the average person. So it makes sense that this product really helps athletes because of that. And I've been on it now 5 years, and I'll never stop taking Protandim. And along the way, after seeing the results with this product, I found myself naturally sharing it with others. And I kept an open mind when I was presented with the other piece to this, which is also to own your own little mini franchise, if you were, with this company, this publicly traded company, where you have the sole rights to share this with other people. And that's, once I wrapped my mind around that piece, I started to do that. And I started to share this with other athletes. One is Gary Stern. He's 5 times state time trial champion in Florida. And he saw the vision. He understood this because he was a top pharmaceutical rep, but he hated that industry. He wanted to get out. He joined me in this, and we started sharing this information, the products, and also the opportunity. And just to highlight how keeping an open mind at that time and open to a new opportunity was so important. Here we are 5 years on. And one of my businesses is a bike tour business. In fact, you can see in that picture, bottom right, that's me in France at one of our Tour de France bike tours. Well, last year we had a record year. We had an amazing year. And this year we're having probably our worst year ever. In fact, we may even lose money this year. And it's because of the terrorism, what's going on in Europe and all of that. So if I hadn't, dug the well before I was thirsty, if I hadn't kept an open mind back then and realized that, hey, it makes sense to have another stream of income, why not, right? People want these products. We have the science. We have the patents. People want this. We just need to share it. And if I hadn't kept an open mind back then and started to share this opportunity as well as these products, today I'd be in a very bad place. We have a baby on the way, and it would be a very, very stressful time because that income from that other business is not there this year. So that's a little bit about my journey. Another product that I really love is also Axio. It's also a nerve 2 activator. The New Zealand pine bark does activate nerve 2. And it's an amazing product. I take it before training. I'll take it to get myself mentally in the zone. It helps you get super focused. What I love is that it doesn't have artificial coloring or sweeteners like most energy drinks. And it's also something you mix in water, very low in calories. But the herbs in there really help you mentally focus. DMAE produces choline in the brain. There's L-theanine, helps you get very centered and focused. One of them has caffeine, also gives you that extra focus. So that's another great product for athletes to check out. It's called Axia, one of my favorites. So that's a little bit about my story. I'll turn it back to you, Karen.
So anyway, thank you for listening to all of that, because hopefully, Stephanie, that gave you kind of a good background. What kind of questions do you have on the science and our technology?
Oh gosh, I would probably have to think about it a little bit more before I would have because I didn't even know what I was going to be talking to you about today. So this is all different. I have my sister in California has a nutrition business.
Oh, great.
So I would really naturally call her and say, hey, I just heard about this new product, and we probably would talk about it. But I think a lot of the stuff that you presented, a lot of it really does make sense to me, and about the cells, sort of producing their own enzymes to fight, whatever inflammation's going on in our bodies. That makes total sense to me. And it's very interesting, and I would consider trying it.
Right.
But I don't know, how much does it cost?
Yeah, I'll run as quickly as I can through the rest of this. And share that with you. It's ridiculous, how low priced all of our products are. It's really exciting. So super quick, the company built on our flagship product, which was Protandim, the NRF2 activator. We now have a NRF1 activator that reminds the cells how to go in and make more mitochondria. Your sister will love this. Mitochondria are our really the engines, the energy source for every cell in our body. More mitochondria, you have that energy of youth. And so that's our second product. Our third product they mentioned was Axio. So it is, once again, a category creating product. Nothing else does what our Axio does for mental clarity, focus, energy. And I use this with a lot of our athletes. Like Nick, the snowboarder, says before every race he'll chug a double, and he says, the difference between winning and 6th or 7th place is often just having your head in the game. And those fine motor skills, like I see my kids when they drink it and they go out and play lacrosse, they'll be kind of sluggish on the sidelines. They'll have an Axio, and then it's bam, stick, hand-eye coordination. They're spinning around backwards, scoring. And the coach is like, where did that come from? And I'm like, cheers. It's Axio, so it's an all-natural energy drink, NRF2 activator. I call it a biochemical wake-up call for the whole body. And then we have this product here. It's our skincare line. Again, the science in this skincare line, I could take a whole webinar up as well. We've had universities around the world study it because it is NRF2 activation. So when you understand NRF2, getting every cell in the body functioning the way it did when you were an infant, where do you want that but your skin, your largest organ? And so we have one study from Louisiana State University called Protandim, which is literally, this is liquid Protandim, a fundamentally new approach to chemo prevention, because they use it in a study for melanoma skin cancer. So there's so much science, but I don't want to bore you with it. Just know that we have a skincare line that there is no comparison for. It too is patented, and it's all NRF activation. And then our last product is called Physique, and it is a weight management system. We're first in the country to bring to market, once again, solving biochemically why it is as we age, we start to store visceral fat. The first company in the United States to offer this technology, all natural, visceral fat, enzyme inducing, that burns that stomach fat. And the studies on this equal, because again, we really are a biotechnologies company that had to choose network marketing as its distribution model, because bringing these products to market was so impossible on a store shelf. And so by educating our distributors who love the products, will never go off them, and then we share them with one another, we start to build this mega side, we call it, income diversification. And so starting a LifeVantage business, this is, we're a publicly traded company. This is our audited income claim statement. And we show people, we actually have a business model that allows people to replace their income in 8 months. And I say, like, everything in this presentation sounds too good to be true, but someone who understands, blogging and building awareness for themselves, talking about things in a way that intrigues, and then you're able to get people, whether you know them or not, onto a webinar scenario where you can truly provide the education, the business grows so quickly. And this is the average income our distributors make on a monthly basis. Now, it took me 3 years to grow my business to an Elite Pro 7 rank. And I've kind of stayed there for a while because, again, I get people introduced to it. They love it, but they don't reach out and tell other people. But I'm working on that. Yes. But it took me 3 years to get to Pro 7. But at that time, all we had was our one product, Pro Tandem. And so I built my business in $40 increments. Whereas today, we're building the business much quicker. And the interesting element about the Pro 7 rank, I'll explain right next. In fact, I'm going to skip this video because I don't want to take up too much time. So there are 4 ways you can get involved with LifeVantage. First is you can be a customer. You can order from Lois. Lois has an online global store. You just go online and you can order any products you want. But what we try to teach people to do is open their own store, order from themselves, and continue to grow this process. And there's 3 ways to start your LifeVantage store. As Simon mentioned, just makes sense. You're going to tell people about these things. So our Freedom Pack, we call it kind of our glorified customer. They earn commissions and they earn their products for free. $300, you're starting with our Nerf 1, our Nerf 2, our Axio, and some of our skincare product. The $600 Vantage Pack gets you into earning serious commissions on new partners that you bring in. And anyone who's interested in and looking at this as a diversification asset to build definitely gets in at either the Vantage or our Platinum Pack. For $1,200, our Platinum Pack, you have all of our products, so you're started on everything. You start to look better, feel better. People are asking, what is going on? And you have your global store with all the tools, including our training program, which is very helpful. People jokingly will ask, so what does it mean if I open my store? And I say, we're anything but your typical network marketing company. There's no product. We're not required to buy and store and have samples of anything. We don't do that. Pro Tandem is not something you sample. I'm like, either I've educated you enough to say, get on it. And I tell people, you need to be on it for 1 month for every decade you've been alive. It's taken you, if you're 40 years old, it's taken you 40 years to build up the issues in your body. It's not going to go away. You're not treating a symptom. It's not going to disappear in a week. It'll take 4 months before you realize, like, I'll never stop taking this. So for that reason, we don't stock samples. And I see people who say, hey, Karen, you're looking great. I really want to try what you have. I give them a card and tell them to go to my store. Order it. And so LifeVantage handles everything else for us. Like I said, we're not running around with goodie bags and delivering things and following up. They handle customer service, delivery, payment processing, shipping, receiving, all of that. They handle all the scientific research. They handle all the new product development. They handle your website and all the marketing materials that we could ever ask for, especially for online marketing. All we do is this. We call a friend and say, look, are you interested? I've got something you need to hear about. And we educate. And for that, you're extraordinarily well compensated. So super quick, everyone's used to, LifeVantage pays us in 6 extremely generous ways. Linear payment is what most people are used to. You go to work, you're paid for a job well done. LifeVantage is the same way. We have a linear component to our pay scale, and that is introduce somebody new, and you're heavily compensated for either 40% of every new product sold out of your store, or any new partner that comes in is an instant commission to you. And so you bring someone in at the $1,200 Platinum Pack, LifeVantage pays you that next Friday a $500 bonus for doing a job well done. Bring in 5 people in a month. Not only do you make $2,500 in those bonuses, but you also qualify for bonus pools. And so typically a person who brings in 5 new partners on a month is making about $4,300 in linear pay. But that's not why you would join LifeVantage. LifeVantage is all about residual income. And that is, obviously, I'm sure you're familiar, authors, actors, make residual. They do the work once, paid on it over and over. Same with LifeVantage. Doesn't matter who you introduce our products to, they're going to stay on them. And there's nothing else on the market to compete. We have patents on our product. First product that a patent lasts through 2031. So we will be, Pro Tandem will be the name for an activator, around the world, just like Kleenex and tissues.
Right.
Eventually there'll be lots of competitive products on the market, and there'll be lots of drugs on the market that do it as well. That's fine. Our niche is going to be those who don't want synthetic ingredients in their bodies, want Nerve 2 activated. Between now and 2031, get hooked on our a solution. So royalties start to add up. But here's what's really exciting, okay? This is what made me take LifeVantage very seriously. And even at $40 a sale, I built my business, is this elite bonus pool. One of the only companies to offer what's called an elite pool. So once you reach that rank of Pro 7, which means just having $100,000 in organizational volume beneath you. So in 1 month, if you enrolled 100 Platinum Pack partners, you're already an elite partner, and you are earning a percent of every product sold anywhere in the world forever. And so when you understand that, it's like the work that you do in most network marketing companies, you kind of have to keep it going. You got balls in the air, people falling off, and you're always adding. With LifeVantage, once you build it, you're done. And at that point, you're sharing in a percent of every product sold anywhere in the world. It's like I alluded to, like Mary Kay. If, you know, my grandmother had learned about Mary Kay, and Mary Kay offered this bonus, me, my children, and my children's future children would all be earning a percent of any mascara sold anywhere in the world. Mary Kay doesn't offer this bonus, but we do. And soon we will be, we just launched actually June 1st in the Netherlands. We launched in the UK the month before in April. And all of Europe is next. And the Europeans are not like Americans. They don't like Western medicine. They understand prevention and health. And so once we can get back the fact that we're an American company, they're really jumping on board. That's our biggest caveat. But so real quickly, you know, this is our complete audited income claim statement. And so obviously there's a minimum. Some people join the company and do nothing. Some people join the company and are, you know, home run hitters immediately, and still at the Pro 1 rank, they're making a huge volume because they went out and enrolled a bunch of people in 1 month. Does that make sense?
Yeah, sure. I have friends that actually do this kind of stuff for other companies.
Oh, cool. Okay.
I'm familiar with the concept, and they love it.
So it is. It really grows very, very fast. And so this is our program that helps people understand how they can literally retire in 8 months by doing the very base minimum. And that minimum is enrolling 1 new partner a month at the platinum level and helping that partner do the same thing. And everyone having that same goal. And I find athletes to be the best people to enroll on this program, because those are the type of people who won't go to sleep on the 31st of the month if they haven't done their job, which is bring in 1 new partner. Doesn't matter how crazy busy they may be in everything else in their lives, they take this responsibility seriously, because not only are they building their own retirement in 8 months, but they're helping everyone on their team do the same. And so really, really simple. You know, your first month, it's you think of 1 partner, maybe your sister, who would say, yeah, let's do this. Pretty cool. Your first month, you join at $1,200, you make $500. Next month, you go out and you help your sister find 1 partner, and you find 1 other. You're now a team of 4. You've made $620. You've earned all your money back, and your sister earns $500. On and on and on. Month 8, you and your sister are now Pro 7s, earning a share of any product sold anywhere in the world. And every new country that opens is just a raise to you. It's passive income. You didn't have to do anything in the UK to earn a percent of every sale in the UK. Month 9, you and your sister's first new partners are hitting the rank of Pro 7. They're retiring with their residual income. And you guys are now Pro 8s. Hopefully that makes sense. And you're earning in 2 shares of the global pool. And that's why between, you know, Pro 6 and Pro 7, the income grows so quickly. That's the global pool growth. And it doubles again, doubles again, doubles again. And so, you know, very, very simple. I say January is coming. That's 8 months from now. And people who just take this, you know, mildly serious, do the minimum 1 new partner and minimum store sales, they'll be here. You'll have some people that will run with it much harder. You'll have people that will do less. But what you're looking for are the ones that take retiring in 8 months, or I should say replacing their income in 8 months, really quite seriously. And so that's it. I close on the same slide we opened with, which is, you know, timing and technology and what happens during that hesitation phase when you're introduced to something and you don't take action. And that's fine. There are a lot of people who hear things like this, whose response to me is, you know, Ellie, if it's all that great, I don't understand why my doctor doesn't know about it yet. Or if it's really all that great, I don't understand why Lois is telling me about it. You can snooze on this, but I tell you, in 2 to 5 years, your doctor will be prescribing a Nerve 2 activator we've talked to a lot of insurance brokers who believe that, the insurance industry will start offering a discount to patients that are taking some kind of a probably pharmaceutical nerve-2 activator. It's a win-win in that scenario. So what you do with this technology in the very start is really what's key. And do you benefit financially from the opportunity, or do you wait and become a consumer when everyone else is? So, but I'd love to help you introduce it to your sister, because I always find that when people try to introduce it to someone else, it's tough because she's going to probably ask some good questions. So, in fact, I think we actually recorded this. You could even have your sister watch this webinar that you were a part of, and see what kind of questions she has. And I'd love to help her answer them.
Yeah, I would. I will definitely reach out to her about this, because she'd be very interested.
Where is she? What part of California?
She's in Manhattan Beach.
Okay.
Oh my God.
She could come to.
Yeah.
Go ahead.
She would really be interested. She and her, she has an assistant, and her company is called Rado Nutrition. They work with a lot of pro athletes.
Oh my gosh.
What's the name?
Yeah, so Rado Nutrition.
Okay.
So they work with several, professional athletes from hockey to football.
Oh my gosh, we have to share this with her. So quickly, it's kind of short notice, but that doctor that happened to be part of the interview, Dr. Mark Gordon, is going to be in LA this Saturday, June 4th, I think it is, explaining to a group of combination doctors and distributors, what we have our hands on. So if there's any way you could talk with her sooner rather than later, and she's interested.
Yeah, no, I'll definitely reach out to her today. Honestly, I don't know her schedule, but I guess I'll have your contact information, or how do you want me to? You tell me. But
let me get your email, and I will send you a link to this.
Perfect.
And then you can share that with her.
That'll work great.
Okay.
STEPHTA@comcast.net.
So StephTA at comcast.net.
Correct.
Cool.
Okay. So my natural inclination is to try the product, and I will just order it through your store.
Yep.
And then, because I would never go into business with something that I haven't tried. I just would never do that.
Yep, I totally respect that. And we should definitely talk to your sister, because what we might want to do is set up, so you can buy the products, but with the business, you're actually getting as many products as you invest in the business. So it might, if your sister was intrigued enough to say, yeah, let's give this a try, it might move you guys to just buy one business. Get on the product.
Okay, because I can wait a few days.
Great. Yeah. And then you're moving forward. And I joke, but it's serious. Universities around the world have tested this. That's what's cool about our products. Is it's science. It's not hype. You're a mammal. Oxidative stress is building up in your body, and that's what's causing the issues. Really, at all ages, but especially as we age. And
have you ever heard of telomere?
Yeah.
Supplement. I'm taking that right now.
Telomeres, here's what's cool. So Isagenix, I know especially, sells a number of products that deal with the telomere lengthening. But what's interesting is what causes the shortening of the telomeres is oxidative stress. And so if your telomeres never shorten, you don't need to lengthen them. I mean, it's two different approaches really to the same kind of science, but one LifeVantage is kind of at the cause of what's causing the problems versus treating the symptoms of the problems.
Right.
Yeah, but the telomere science is phenomenal, and there's a lot of research in that, absolutely that direction. And so, ultimately these kind of work in tandem. Yep, that's cool.
Awesome. Well, so you send me that, and then I'll send it to my sister, and we'll chat, and I will try the product either by buying it into a store or buying it from you first before I set that up.
Okay,
sounds great. I appreciate you taking the time, Steph.
Yeah, absolutely, Lois. It's so good to see you.
You.
And nice to meet you, Karen.
Great meeting you, Steph.
Have a great rest of your week.
Thank you. You too.
Talk again soon. Yeah. Okay, bye-bye.
Bye.
Yeah.
I know that there's a little end meeting.